Guys, today the topic of our discussion is venous drainage of the lower limb. The venous drainage of the lower limb consists of superficial veins, deep veins and perforating veins. The superficial veins further consist of great saphenous vein and small saphenous vein. The deep veins are formed by the vena communicants of the anterior and posterior tibial artery here, and then the popliteal artery and the femoral artery. These all form the vena communicants which form the deep veins of the lower limb. Then are the perforating veins. Perforating veins are those which connect the deep veins to the superficial veins. They have valves in them. For example, if we see this diagram, this is the skin, this is the superficial fascia, and these are the superficial veins and these are the muscles, and the superficial veins are connected to the vena communicants of the artery. This is the artery and this is the deep vena communicants. These are connected through the perforating veins. Perforating veins hence connect the superficial and deep venous system of the lower limb. When there is resting condition and exercise, the facial compartments, there are muscles. These muscles exert pressure on the deep veins, and hence the blood is flown upwards to the heart. These excessive pressure is prevented to flow in the superficial veins by these perforating veins, and the valves which prevent these valves prevent there are valves in here. These valves prevent this pressure to be transmitted from the deep to the superficial veins. When these the varicose veins are formed when there are large, elongated and tortuous veins which are formed due to increased pressure in the deep veins, which is transmitted through the perforating veins to the superficial veins due to the incompetency of valves. Because the valves are not competent and they transmit the pressure from the deep to the superficial veins, and hence these veins becomes elongated, tortuous and large in diameter than normal. This deformity is known as the varicose vein. These are most common in esophageal varices, etc. But in lower limb, these are caused by the superficial veins of the lower limb. The causes are hereditary weakness of the veins or the incompetent valves and increased abdominal pressure when there is multiple pregnancies, and any abdominal increases the pressure. This pressure is to the deep veins of the and hence to the superficial veins. In exercise, when there is incompetence of the valves, the deep venous pressure is transmitted to the superficial veins and hence form the varicosity. There is one of the another cause in thrombophlebitis, the deep veins, where there is infection or inflammation of the deep veins. So superficial veins workload on the veins is, and they become tortuous, elongated and larger in diameter. The treatment of varicose vein, irrigation and division of the superficial veins. Now, if we discuss the superficial veins first, the most important one is the great saphenous vein. The great saphenous vein starts from the dorsal venous arch, from the medial side of the dorsal venous arch, and it flows upwards to the medial side of the leg, and it goes backwards to the knee. When it comes in the mid of the thigh, it is curved forwards in the medial side of the thigh, and it drains into the femoral vein in the saphenous opening, which is below and lateral to this pubic tubercle. The three tributaries which enter into the saphenous vein into the femoral vein are the superficial circumflex iliac vein, the superficial external pudendal vein, and the superficial epigastric vein. And there is also a accessory vein in the middle of the thigh which is drained into the saphenous vein. There is the small saphenous vein on the lateral side, and the small and the great saphenous vein are connected to valves or branching tributaries or connecting branches.